الخير. طبعا يعني كلكم تعبانين، يعني سيشنز عماله مطوله واحد ورا التاني، بس very interesting actually. يعني دكتور محمد الصحة. Very interesting topics were very interesting also presentations. Session دي عن sustainability and affordability. Where localization is an answer to no. So we have 3 topics together in one session. وانا هحاول اكون مختصره، وانا اعتقد برضه المجموعه اللي معايا كلها تكون في حدود الوقت اللي كان محدد لنا. يعني sustainability هو ده الموضوع اساسا يعني في المؤتمر هنا. describes the system that meets the health needs of the present situation without compromising the health and future generations. بنتكلم في sustainability الاستمرارية. sustainability of sustainable healthcare is about understanding that our health and that our environment around us are linked and acting in a way that supports both people and the planet. في نفس الوقت بنتكلم عن affordability. والaffordability يعني in general whether a person or an organization or an institution has the efficient income to meet health services needs. ممكن يبقى في لينك ما بينهم، ممكن يبقى في overlap ما بينهم، لأن once you have the income then you are able to satisfy your needs, which may and may not match with the society's objectives regarding sustainability and regarding the planet needs. This is one. And here we talk then again about localization. I will not talk more about it because I know that Dr. Hannah Saad has done a lot about it, and she's going to discuss it with us. We have in this panel Professor Hannah Saad, Dean of Economics and Political Politics in Lisa University. And we have Dr. Amin Soliman. She's Associate Professor of Political Studies at the University of Hertfordshire, Egypt and UK. And we have Dr. Mohammed Hamid, Head of Case Management, Medland, Egypt. And Dr. Pakinan, she's Assistant Professor at Faculty of Economics and Political Science and the coordinator of the Master Program of Economics at the Faculty of Economics and Political Science. I will start with you, Dr. Pakinan, because I want you to understand what you mean with sustainable health system.
When we talk about sustainability of any organization, when we talk about sustainability of health system, we need the system to have a sufficient number of resources to satisfy the needs of the patients, and that the system is adaptable to the changing environment surrounding the system. What about the health system, the sustainability of the health system? It has 5 key main attributes. First, the system needs to be affordable. Patients will have access to health services without facing any financial hardship. Then have accessibility. For the system to be accessible, then we need to ensure that the system provides the ability or is able to meet the needs, the preferences and expectations of both the patients and the health professionals. It should provide the patients with the high quality services that they need and the health professionals with the training, support and fair compensation. With that shall ensure the trust and confidence in the system, and it will increase the level of satisfaction of the patients and of the health professionals. The third attribute is the adaptability. The system needs to be able to adapt to the changing environment in light of the emergence of new diseases, appearance of new technologies, and the changing demography of the population. Also, the system needs to be able to match between the supply and demand to ensure that it is operating or it is utilizing its resources efficiently without any excess capacity. And it's important also to realize in the health system or sustainability in the health system is related to the planetary health. So how we use our resources in the system will affect the environment, and the environment will in turn affect the health as well. So if the health facilities, the clinics, the hospitals did not adopt sustainable systems, this will increase the level of energy consumption, it will increase the waste and the pollutants, وبالتالي it will increase the carbon footprint of the system. In addition to that, the degradation in the environment will have also a negative impact on the health. هتخلي في emergence in the public health issues. هيبقى في emergence in the vector-borne and the water-borne diseases and the respiratory diseases.
Thank you. That was very concise and precise. Dr. Anil, can you tell me how using real-world data from local context can balance affordability and sustainability?
Thanks, Dr. Heba. I'm very interested to talk about how using real-world data can help to maintain sustainability and affordability. And in this context, I would like to stress on the importance of having local data from local contexts, because this is the cornerstone اللي على أساسها we will generate the real-world evidence. فإحنا we're talking about sustainability, where I would focus on three main pillars within sustainability: financial sustainability, population health, and sustainability for service delivery, as part of a framework that we have worked on, a collaborative project with LSE. So to maintain the sustainability for three main pillars, we need to have data about the health outcomes for the patients. We need to have data about how much we spend relative to the benefits gained in terms of health outcomes. According to allocated budgets willingness to pay من ناحية affordability, we can actually compare the data بتاعت how much we are willing to pay with affordability relative to what we are achieving in health outcomes relative to the costs of care.
Thank you. That was also concise and precise as usual. And Dr. Mohammed, now I want to talk about the private medical sector. How can you cooperate between the private medical sector and the pharmaceutical producer companies for the benefit of patients, sustainability, and affordability?
Okay. First of all, I would like to thank you, Dr. Heba, Dr. Jan, for giving me this great opportunity. First, I would explain there is different types of private insurance in Egypt: self-insured and third-party, non-risk holder, and finally the risk holder company. It is a private health insurance company. Okay, we are all looking for an patient centricity, but in this inflation rate, we forcing a very challenging opportunity to keep it by maximum benefits for our client. So we are looking for a different out-of-box solutions. One of this solution is a collaboration with a pharmaceutical company to give this maximum benefits for our clients in form of patient support program, in form of health education, in form of hotlines for our clients to maximize the benefits for our clients. Okay, in our company we are collaborating nowadays with a big producer pharmaceutical company, multinational company, to give our clients this great opportunity to facing the inflation rate. By the way, the inflation rate is directly affecting the private health insurance sector, as I mentioned before. Self-insurance company facing a lot of challenging because it is an payer for the medical services. Third party is just controlling the medical services, so the challenge is not bigger as a self-insurer. But in a private health insurance company, it is a risk holder, it is have a lot of challenging in form of inflation of the medical services as a whole, medications, it is a big expensive medications, and we have also immunological and biological items. It is also expenses, high expenses and the high burden for the private health insurance. So the collaboration between private health insurance and the producer pharmaceutical company is a must in this inflation rate era. And the most example and most fruitful example is in form of patient support program, mainly for an biological treatment and immunological diseases, medications, and also for biological medications and innovative medications, especially for oncology and for immunological diseases.
Thank you, Dr. Mohammed.
Thank you.
Now we turn to the subject of localization here. To what extent can health services be a solution? Can services localization be a solution in developing countries?
Okay, thank you, Dr. Heba. I'll start by answering such a question by defining what do we mean by localization and why we began not on the domestic level but even on the international level to talk about localization and what does it mean. We all know that we faced a disaster which was the COVID-19. In addition, it was followed by the wars, whether the Ukrainian war and the following war all over the world nowadays. Having a problem to have sustainable health service or to have the medicine or so made all the international organizations as well as all the doctors and physicians to ask a question: how can we guarantee that we can provide our patients with what they need? So instead of thinking to open up and to globalize, we have now to think the other way around. How can we use our domestic resources in order to satisfy our needs? How can we depend locally on ourselves as much as we can in order to be resilient? يعني لما تجيلنا أي أزمة ما نقفش مش لاقيين الدواء مش لاقيين الخدمة. We can provide our patients as much as we can, even if it is just 50 or 60%. So sustainability is very much related to resilience, اللي هي لما نقف تاني أو we are not volatile, we are not volatile that we cannot face our needs again. So defining localization simply has two sides. The first side is how to use your domestic resources to provide energy using the sun, for example, to solar energy in the hospitals, how to use the domestic resources in satisfying most of our needs within the hospital. I'm not talking here about the equipments or the sophisticated machines and so on. I'm talking about a lot of expenses that we import from abroad instead of just providing it domestically. How to depend on our physicians, on our pharmacologists, or the experts instead of the brain drain that we are facing. So we are in a way or another localizing, decentralizing. When I'm talking about decentralization, I'm adding that we all have to participate in the decision and taking the responsibility of a lot of what's happening within the health sector. All this was one definition of localization. The second definition, which is very much important, is the adapting of the product and the service and the campaigns within the health sector to our context. وهنا هدي مثال بالعربي قد ايه كنا بنصرف على تنظيم الاسره، قد ايه كنا بنصرف على منع جواز الزواج المبكر، قضايا ختان الاناث، وليه ما كانتش بتحقق المردود؟ Because it was not localized. كانت بتيجي بنقول there's an international organization or international call that wants us to face such a problem. لكن عمرنا ما نزلنا على مستوى الا مؤخرا برضه عشان ما بقاش متشائمه قوي على مستوى القرى نكلم الناس والنجوع، نكلم الناس باللغه اللي يفهموها، نكلم الناس من خلال الجوامع والكنائس. يبقى it is localizing the content to reach what you want. Why would I localize to guarantee the resilience or the sustainability? Because first of all, localizing and working on the governorate level and below will increase the level of accessibility of the health service, will raise the level of equity, and will for sure raise the level of efficiency, which are the three main targets of any health service. In addition to that, we will be more resilient, we'll have a better doctor-patient relationship, and we will reduce somehow the brain drain.
Okay, Dr. Pakidam, how can healthcare sustainability be achieved?
Okay, in order to achieve healthcare sustainability, we have 6 main pillars. First, we need to realize that the healthcare is an open system. What happens in the healthcare system is related to other systems, affects it and is affected by it. So, if we want to achieve sustainability in the health system, we need also to ensure that sustainability measures are going to be applied in other systems. The second thing to ensure sustainability is the resources. We need to ensure that the health system has the sufficient resources to to meet or to match between the supply and demand, to provide fair compensation for healthcare providers, and to finance preventive measures in order to reduce the costly treatments or the expenditure on costly treatments and hospitalization. The third thing, we need to ensure that the system is adaptable and resilient. How to ensure its adaptability to the changing environment? The system needs to adopt innovation, technologies, create a culture of continuous learning and improvement to ensure that there will be an improvement in the access and quality of the healthcare services. And the resilience, it can achieve it through making the community participate in the decision-making process, through determining their needs, and thus we can ensure an efficient allocation of our resources to satisfy those needs without any wastage of those resources. The fourth thing is the adoption of information technology. This shall have an impact on the carbon footprint of the system through the adoption or transformation from paper-based records to electronic-based records and the adoption of telehealth. This shall accelerate access to care and reduce the travel time or going to the healthcare providers. Also, the system should adopt the notion of the circular economy. The medical equipment used in the system should be reused and should be circulated over and over again as long as we can use it. So this will again increase the efficiency of our resources and reduce the carbon footprint. And finally, the value-based healthcare should be adopted as well, where there is an integration of the disease treatment instead of depending on ad hoc referral of the patients.
Okay, thank you. Then from the value-based healthcare, what's the role of value-based healthcare in health system and sustainability?
Okay, when we talk about value-based healthcare, it's more of a health systems approach. It's different from a health economic evaluation tool or a decision tool. It's a holistic approach for a health system. And worldwide, there are different concepts and different definitions of how healthcare, value-based healthcare is defined. So for instance, from the US healthcare perspective, they define value-based healthcare as the health outcomes achieved per money spent بنصرف قد ايه والنتائج بتاعت المرضى قد ايه relatively. Where for another example, from the UK approach, they defined value-based healthcare from a more holistic approach. علشان this is following the universal health coverage system that is being adopted in the UK. And they define it as 3 different types of value: technical value, allocative, and personal value. Technical value, this is the one concerned with the efficiency, but it is how well the resources are being utilized to improve the health outcomes of the patients. But still, UK approach, they also include the allocative value. هو مش بس are we making the maximum utilization of the resources ولا لأ، لكن are we allocating the resources to the proper group of patients who actually need these kind of services. This part is missed from the US health system. علشان the UK approach is very close to the Egyptian healthcare system مع the application of the national health insurance. And احنا we're looking at a population health towards universal health coverage. وآخر element is the value, is the personal value, اللي هو it relates to the patient preferences and the patient's value. Where the integration of these 3 types of value, it will maintain sustainability. لما نقدر maximize the use of the available resources to achieve the patient the best health outcomes possible. We're achieving sustainability في financing بتاع health systems, sustainability في improved population health, وبرضه في delivery of the services. We're sure we're delivering the maximum resources that will achieve the best health outcomes.
That's pure economics now. And then the role of the private sector here, in insurance companies here, in bearing the risks of the burden of the cost of health services to achieve sustainability. Can you talk about it, Dr. Mohammed?
We have an example for the COVID-19 era in past years. The private sector, although it is out of coverage, any pandemic disease, it's out of coverage of private health insurance, but there is a big room. وبصراحة التأمين الصحي الخاص تحمل بردن كبير جدا رغم ان هو غير مغطى ومش مكتوب في التيبل اوف بنفيتس ولا كانت البريميوم بتاعت الستيك هولدر كانت مدفوعة فيها الكوست بتاعت البانديميك ان شركات البرايفت هيلث انشورنس اشتركت في تغطيه الخدمه الطبيه في مصر، وتحملت بردن كبير جدا واعباء كبيره، وتحملت مع الدوله اعباء الكوفيد for the clients of the private health insurance sector. Okay. On the other hand, we have now a great pool of clients in private health insurance. It is covering all over the government nowadays. And they have a lot of.
معلش بس البوينت اوف كلاريفيكيشن برايفت هيلث انشورنس تحمل كوفيد. I think it was يعني أي واحد كان عنده private insurance كان يعني COVID is something else.
Okay.
It was outside the package.
أنا قلت لحضرتك هو out of package و out of coverage، بس شركات التأمين الطبي الكبيرة في مصر تحملت، ويمكن لو هنتكلم على ميت لايف يعني احنا تحملنا من day 1 للكوفيد، احنا تحملنا مش بس البردن بتاع الادمشن، لا من الأول خالص السكرينينج، consultation، الانفستيجيشنز، الادمشن، الايزوليشن، ايفن حتى اللايف انشورنس بيردن. يعني حضرتك عارفه احنا في البرايفت هيلث انشورنس عندنا جزء ميديكال وعندنا جزء لايف انشورنس. اوكي. ورغم زي ما بقول لحضرتك هو اوت اوف كفرج ومش مدفوع في البريميوم، انما معظم الشركات مش بس ميت لايف، معظم الشركات في مصر هنا تحملت الكوست بتاعت الكوفيد، ولحد دلوقتي ايفن لو في اي كيس كوفيد شركات البرايفت هيلث انشورنس بتتحملها، ويمكن ده موجود في الشركات الكبيره كلها في مصر. وده مثال واضح جدا لتحمل المسؤوليه المجتمعيه. وعاوز اقول لحضرتك هو احنا looking for an ambitious investor reputation، يعني ده reflected على ميت لايف. يمكن لو هنتكلم على الشركه عندنا البول اوف بيشنت اللي بتتحول من السيلف انشورنس سيلف انشورنس والثيرد بارتي انشورنس اللي هو نون ريسك هولدر، تحول لشركات البرايفت هيلث انشورنس الكبيره اللي كان عندها تحمل البردن بتاع الكوفيد. احنا عندنا دلوقتي ارقام كبيره جدا موجوده في البرايفت هيلث انشورنس سيكتورز في الديفرنت مالتي ناشونال برايفت هيلث انشورنس كمان. فده
Good
جزء
to know that. If you go back to the topic of
يعني باكد على حضرتك، بس مش كده وبس، احنا كمان عندنا بادجت
عملنا حديث بعد كده.
اوكي. احنا عندنا كمان بادجت للخدمه المجتمعيه في مصر. يمكن بنشترك مع الان جي اوز ومع مؤسسات يمكن مختلفه في مصر في ديفرنت ارياز، يعني ان احنا بنسبورت ببادجت مختلف. يمكن بس الكونفليكت اللي عند حضرتك، لاني بقول حاجه احنا في البرايفت هيلث انشورنس سيكتور في مصر عندنا ديفرنت تايبس. الثيرد بارتي شور هو ما تحملش الكوفيد لان هو بيدير بس الخدمه الطبيه، انما ببقى مؤكد لحضرتك مره ثانيه ان شركات المالتي ناشونال برايفت هيلث انشورنس كامباني في مصر تحملت الكوفيد تحمل كامل يعني. ده على مسؤوليتي الشخصيه.
حاضر. يبقى اخر سؤال سريعا اللي هي innovation digitalization بقى. How can here digitalization and localization have to be relevant? Okay. A very brief answer to this question. Although digitalization, which we are already, and nowadays all of us is talking about the digitalization of healthcare and the importance of technology and telemedicine and the virtual conferences and so on, and the e-health, all this is under the technology that's happening and advancing nowadays. How can I use this digitalization in localization? They are strongly related. If I can use it, actually they can complement each other in the local content. Again, we are talking about, and we are all happy with the medical apps and the software and all this which is around us. But if we look at the segment of the society who are really benefiting, who are really having access to this technology, we'll find it is very, very low percent. But if we consider the Egyptian society all in all and the 110 million people, we have to think how to localize those apps, how to use them to be user-friendly, how to use them in an Arabic language instead of English, how to make it very easy. In this case, we can really benefit from the digitalization in localization. بمعنى بسيط جدا وبإكزامبل بسيط قوي، كلنا بنقول سهل قوي ان انا بدل ما اجي القاهره اقدر اعمل مقابلات واقدر اخد الجرعات الادويه واسال، اوكي، بس ما ينفعش طول ما الاب از انجلش، ما ينفعش طول ما الاب از نوت افيلبل فور ايفري بادي. اول ما ابتدي انزل بالاب ده واعمل له لوكاليزيشن وابسطه واخليه اي حد يقدر، لكن ما اقدرش اقول ان انا هستفيد حاليا في مستوى التكنولوجيكال illiteracy that we are facing.
But we have to consider that when we are putting our investment, we do not take it as it is, sold by the international world. We have to consider our Egyptian case and how can we benefit so that we utilize digitalization again to achieve localization, which is actually to achieve sustainability as much as we can. Thank you.
Thank you. I know we have to run. It was really interesting. I really benefited from this session. And I want to call for Dr. Lamis, my colleague, for the other session. But until she comes and with Dr. Ahmed Khalifa, I can summarize very quickly, Dr. Lamis, that we have talked about many issues regarding sustainability and affordability. And very quickly, health education, cooperation, localization, value-based healthcare, coordination between the systems and the adaptability to have a resilient system. Learning and community participation is also very important to achieve both affordability and sustainability. Dr. Lamis, I don't want to talk more because you have a session with the States now with Dr. Ahmed Khalifa. I'm calling you for this session, and I'm thanking all the participants in this session. It was really, as I said, I benefited from this session a lot, and it's very interesting. So, thank you.